Okay, today we will do exam 4 exercise. Instructions. For best result of this exercise, please study chapter 12, 13, 14, and 15. Prepare some pieces of paper and pens or pencil to write your answer. There will be 2 or 3 seconds after each question to write your answer. To finish the exercise, check your answer, how many are correct and how many are incorrect. Repeat the process until you get 100% correct answer. Make sure that the 100 correct answers are based on your knowledge, not from your guessing. It is very likely that you will get a very good score on your exam 4 if you follow this instruction correctly. Okay, we start with number 1. Identify the combining term pneumo with its closest definition. A, B, C, or D. Okay. Pneumo mean air. So pneumo is mean air. Okay, so the closest definition for pneumo is B, which is air. Identify the combining term of spiral with its closest definitions. A, B, C, or D. A spiral mean breathing. So there is a equipment called the spirometer. This is the equipment that measure our breathing volume. So spiral mean breathing. Identify the combining term of stetho. Stetho with its closest definitions. So remember, when you try to hear or listen the heart beating, you use stethoscope, right? Stethoscope, which is you put it on the chest. So stetho means chest. Pneumonia is general term for infection of the A, B, C, or D. Okay, so pneumonia, remember pneumo means air. Okay, and the place of air in our lung is actually in a special place, okay, which is called the sac, and this sac is called the alveoli. So pneumonia is general term for infections in the alveoli. Abnormally fast breathing is A, B, C, D. Okay, you already know that fast means tachy. Okay, so tachy. So you just combine with breathing, okay, which is apnea. Okay, so it's going to be tachyapnea. Bradyapnea means slow breathing. So brady is the opposite of tachy. So tachyapnea. Listening with the stethoscope is A, B, C, or D. Okay, there are 3 main methods, okay, to observe anatomy or functions of physiology or functions of the body without taking a sample. One of them is called the palpation, which is touching, okay, touching part of the body, just like you measure the pulse rate. Yeah, you touch the, the arm of someone or the neck. Okay? And then another one is called the auscultation, which is listening to the sounds. of the body. So this is listening. Okay. And then the third one is percussion, which is tapping, tapping part of the body, and then listen the sound that coming from that tapping. So this is just listen, listening using the stethoscope. Then it's going to be auscultation. Tapping over the lung area to see if the lungs are clear is called A, B, C, or D. Okay, I just explained to you tapping is percussion. Okay, so it's going to be C, percussion. Promoting coughing to expel mucus is aided by A, B, C, or D. Okay, to expel. Okay, it's going to be expectorants over here. Food is prevented from going into the larynx by the A, B, C, or D. Okay, so let's say this is our mouth and this is our nose. Behind the mouth and the nose, there is area called the pharynx, which is the throat. Okay, so the pharynx will receive both food and the air. And then from the pharynx, the air and the food will be separated. Okay, the food will go to the esophagus. The air will go to the trachea. And then go to the lungs. Now, there is a area between the pharynx and the trachea and esophagus is called larynx. Okay, so larynx. So larynx has several parts. The opening of larynx is called glottis. Glottis. And then there is a gate or a structure that actually close the glottis. It will prevent the food from entering into the trachea. So that part, okay, that structure is called the epiglottis. So the answer will be epiglottis, the structure that will prevent the food from going into the larynx and then trachea and finally go to the lungs. Hypoxemia. Okay, so hypoxemia is a deficient amount of oxygen in blank, while the hypoxia is deficient amount of oxygen in the blank. A, B, C, or D. Okay, you already know the terminology. Emia means blood. Okay. Hypo means low. Okay. This is low concentration of oxygen in the blood. So look for that one first. In the blood. It's only one answer over here that starts with blood. So it's going to be this answer. Okay. Hypoxemia is the low oxygen in the blood, while the hypoxia is the low concentrations in the tissue. So that's the answer for this. A pulmonary embolism is a clot in the A, B, C, or D. A pulmo, you already learned this terminology, which is mean lungs. Okay, so it's going to be the clots in the lungs. The patient states she has asthma. What type of medication would be the healthcare provider anticipates the patient is taking? Okay, so he has asthma. A, B, C, or D. So what is asthma? Asthma is a disease that make the muscles become constrict. Yeah, it will prevent the air entering to the lungs. So the doctor will give him a medication that will open makes the muscle relax, open the bronchus. Okay, dilations here is open or make a muscle to be dilated. So this will be the medication, bronchodilator. The pharynx is divided into how many sections? A, B, C, or D. Okay, I already explained to you. Okay, behind the mouth and the nose is combined together to make area is called the pharynx or the throat. Okay, so if you see from the pharynx, it will go to larynx or the esophagus. So there is 3 parts of the pharynx. So there's gonna be 3 parts. Okay? The first one is behind the nose. It's called the nasopharynx. Okay? And then the second one is behind the mouth. It's called the oropharynx. Okay? And then the one that closer to the larynx. Okay, it's called the laryngopharynx. Okay, so this pharynx or throat is divided into 3 areas. Lymph cell or lymphocytes produce specialized protein that help fight disease known as A, B, C, or D. Okay, we already learned before that lymphocyte consists of 2 types of cell. The first one is called the B cell or B lymphocyte. And the second one is the T cell or T lymphocyte. The B cell is the one that produces protein, is called the antibodies. Another name for antibodies is immunoglobulin. Okay, or sometimes it's called the IG, immunoglobulin. And these antibodies will fight the antigen. Okay, so lymphocyte, especially the B lymphocyte, produce antibodies. Antibodies are produced by A, B, C, or D. Okay, we just mentioned that the one that produces antibody is B lymphocyte. Okay, just remember the letter. Bodies, antibodies produced by B lymphocyte or B cell. Immunoglobulin is a synonym for A, B, C, or D. Okay, I just explained that antibodies is synonym with immunoglobulin or IG. The first antibody to be produced after an infection is A, B, C, or D. Okay, so antibodies or immunoglobulin or IG. There are 5 types. The most abundant one is IgG. The second one is IgA. The third one is IgM. The fourth one is IgD. Okay, and the last one is IgE. Okay, the one that will be produced after, right after infection will be the IgM, and then after that will be IgG. Okay, so this is first, and then IgG second. The IgA is located in liquid of our body, like maybe in our saliva, sweat. Okay, so mostly it is in the liquid part of our body. Okay, instead of in the blood. The other Ig, they are carried or located in the blood. So the answer will be IgM or immunoglobulin M. This immunoglobulin is effective against bacteria, viruses, and toxins. Which one? A, B, C, or D? Of course, this is going to be the one that is the most abundant in our blood. So it's produced so many because it can fight everything. So this is going to be the IgG. This immunoglobulin is found in the breast milk, nasal fluid, tear, sweat, and gastric juices. A, B, C, or D? A. I just explained this is the one that's found in liquid of our body instead of the blood. It's going to be the IgA, globulin A. Allergies are often caused by A, B, C, or D. Okay, so allergy caused by allergens. Okay, allergen is a type of antigens. Okay, so this is caused by antigens. Lymphocytes that attack foreign cell or cell within the body infected with viruses are A, B, C, or D. Okay, again, remember lymphocytes. There are two types. B cell or B lymphocyte. This one produce antibody, okay, Ig. Second one is T cell or T lymphocyte. It has several types, okay. TC or cytotoxic T cell. This is the one that attack viruses. So attack viruses. Another one is called the TH, which is T helper. This is the one that help other lymphocyte, including B cell and TC. Okay, so the answer will be the TC or T cytotoxic. Disease-causing agents are known as A, B, C, or D. Remember again, the terminology for disease is patho. Okay, like pathology is the science of disease. And then agents that causing the disease going to be pathogens. You just combine that. Okay? Pathogens. Vaccination produces what type of immunity? A, B, C, or D? Okay. So immunization. Immunization, it can be divided two types based on how we get it. The first one is natural, which is from disease, like bacteria or viruses, and then acquired. Okay, another name for acquired is artificial, okay, which is we get it from injection of viruses or bacteria. And this is example is vaccination. Vaccination is actually we put agents like viruses into our body to be immune against that disease. So it's going to be acquired or artificial. Which of the following are true of macrophages? A, B, C, or D. Macrophages are white blood cells that have the ability to eat or destroy bacteria and debris. Okay, so it's going to be eat this one, destroy this one. Okay, so it's going to be the most closest one will be trap and digest the cellular debris, including bacteria or viruses. A common cancer of the limb system is A, B, C, D. Okay, this is cancer. Okay, it's a cancer. There's a virus that can cause mononucleosis, which is called the kissing disease. So that's the same name. And also can cause mumps, which is swelling of the salivary glands. And this virus can causing also or stimulate cancer on the limb system. And this cancer is OMA. Remember, OMA means tumor. OMA is tumor or cancer. Okay, just combine that, lymphoma. So lymphoma, cancer or tumor of lymphatic system. A common cancer of the limb system is called lymphoma. The physician has told the patient there is metastasis. The nurse explained to the patient this means, so meta is spreading. This is the cancer cell or tumor cell that spread all over the body or different part of the body. So it's going to be this one, spread. Okay, the disease has spread. The healthcare provider explained the patient a lymphadenectomy is the A, B, C, or D. So ectomy over here is mean remove, okay, or removal. So look for the closest, that one. It's going to be removal of the limb node. The alimentary canal includes the A, B, C, or T. So we are talking about digestive system over here. So digestive system, okay, that consists of two parts. The first one is called alimentary canal. Another name for this one is actually called the digestive tract. Okay, this is a tract. The second one is called the accessory organ of the digestive system. So the first one, alimentary canal or the tract, is the organ that making the track for the food, which is start from mouth and go to pharynx and go to esophagus, then stomach, and then small intestine, then large intestine, rectum, and finally anus. So these are the tract organs. The accessory organ include salivary glands in the mouth, tongue, and teeth. These are in the mouth. And in the abdomen, we have pancreas, liver, and gallbladder. Okay, so there are 3 accessory organs in the mouth and another 3 accessory organs in the abdomen. So there are 6 accessory organs. So the question asking about this canal or the tract. So which one is the tract? Liver is not the tract. This is accessory organ. Stomach, yes. So stomach is the alimentary canal. Gastric juice contains A, B, C, or D. Gastric is the stomach, and stomach produce acid, okay, which is hydrochloric acid. So this should be this one. Gastric juice contains acids. Gastroscopy is a procedure for examining the A, B, C, or D. Again, gaster means stomach. Just look for that. It is the stomach over here. The patient is experiencing vomiting. Which pharmacological agents would be nurse expect to be ordered? Vomit. Right? So vomit is emesis. Emesis means vomit. Therefore, it's going to be anti-emesis or anti-emetic. According to the medical record, the patient is experiencing dysphagia. The healthcare provider known that this is, okay, so fake over here mean eat or food. Okay, so this mean abnormal, right, or difficult. Okay, so just combine that. Difficult eat, it means difficult to swallow. The test buds are contained in A, B, C, or D. Okay, so the test bud is a group of cells that taste the food. It is located in the tongue. Okay, in our tongue, we have a group of cells that making what we call the papilla. And in this papilla, we have this, the taste bud. Okay, so the answer will be the papilla. And usually papilla for sweets located in the tip of the tongue. And then for bitter over here is bitter papilla, located at the end of the tongue. Between them, there is a papillae for salty and sour. Okay, so a lot of papillae on our tongues for tasting the food. Identify the combining term of silo with the closest definition. A, B, C, or D. So silo means lips. And this is the lips. Bako Okay, buko or bako. Buko, this is mean your cheek. Oh, yeah, your cheek. Okay, buko mean cheek. And then coal, chole or choleo, like cholesterol, for example. What is chole over here? It is related to the bile. Identify the combining term of cholangio. Okay, and you have bile over here, and then you have angio mean vessel. They combine that word. It's gonna be the bile vessel. The physician has ordered a cholangiogram, okay? The medical assistant explained to the patient that this is a or an A, B, C, or D angiogram. So this is related to the bile. It's going to be the X-ray of the bile vessel. Combining term of cholecysto. Again, we have bile over here. Okay. Cholecysto. And then we have cis mean place or area or expansions. So this is the place for the bile. Where is the place for the bile? The bladder. Okay, so the bile will be stored in the gallbladder. Then for the combining of choledocco. Again, this is bile. Okay, docco mean which is channel. So that would be the common bile duct. Glosso. Okay. Glosso mean the tongue. Glosso mean the tongue. How about lingo? Language. How you use, how to say something. Language is coming from the tongue. So glossolingual is the same meaning, which is the tongue. Hepato, A, B, C, or D. Hepar mean liver. Okay, so this is going to be liver. Labio, A, B, C, or D. Labio is the lips. Oro. Remember, we heard oral exam. What is oral exam mean? You have to say it, which is mouth. Okay, it's gonna be mouth. Stomato. Stomato, especially in plant, this is also mean mouth. The whole mouth. Procto. So procto, A, B, C, or D. This is opposite of the mouth, which is at the other end of our alimentary canal or our digestive tract. Okay, in one end we have mouth, and then after continue, there is an anus over here. Okay, so this one will be anus, procto. And then for the combining term of laryngo. Laryngo, of course, this is easy. What laryngo means larynx. And then duodeno, again, you have the easy question over here, duodenum. So if you see the, say this is small intestine, okay, small intestine, okay, it's divided into 3 parts. Okay, the first part is called a duodenum. This is the first part. And then the middle part, the longest part, okay, is called the jejunum. And the last part over here is called the ileum. Okay, so duodenum, jejunum, ileum. This is part of the small intestine. Ileum or ileo, that's easy. Jejunum, which is the jejunum, the second part or the middle part of the small intestine. Colon, okay, colon. Okay, what is colon? So after the small intestine, then it's become what we call the large intestine. Large intestine. Okay, that also have 3 parts. Okay, and this large intestine, another name for large intestine is colon. Okay, colon is the same as large intestine. So colon over here. Sickle, it means cecum. This is especially for animal that eat plant, like cow. They have cecum, which is the place for digesting the cellulose, the hardest part of the plants. Esophag, going to be esophagus. It's after pharynx. Gluco means sugar. It's going to be this one. Glycogeno. Okay, glycogen is actually stored compounds of sugar. So sugar, especially in animal, will combine together, will be stored as a glycogen, usually in the liver. So liver is the main place for glycogen or sugar storage. Sorry, this is wrong answer. Okay, so this should be C, glycogen. And then the combining term of steto means the fat. Okay, this is fat. The patient admitting diagnosis is bulimia. So bulimia. The nurse recognize this as bulimia means eat and then vomit. Eat, vomit. This is a disorder where the patient is vomiting after eating. What type of surgery might an obese patient have? A, B, C, or D? A, colectomy. This is a removal of colon, which is not for this obese patient. Vasectomy, this is for sterilization. This is not. This is for male. This is tubectomy, which is female sterilization, which is not. So it's going to be the last one over here, gastric resection. Okay, making gastric smaller. Or make smaller. The outer portion of the kidney is the A, B, C, or D. So if we have kidney look like this, okay, then we have 3 main layers. The outer part over here is called cortex. Okay? Sometimes it's called a renal cortex. Renal means kidney. The middle part is called medulla, okay? Or renal medulla. The last one is called the pelvis or renal pelvis. So this is outer will be the cortex. The middle portion of the kidney is the, again, we already mentioned that, will be medulla. The collecting area for urine in the center of kidney is the, it's to be the last part, which is this part over here. Okay, so this one is called the pelvis. Okay, from the pelvis, the urine will go to the ureters. So remember, we have two kidney over here. So we're going to have two ureter, and this is pelvis. Okay, so pelvis is the answer. The tube that connect each kidney to the urinary bladder are known as A, B, C, or D. Okay, we just mentioned that there are two kidney and there is a tube that will take the urine to the bladder. Okay, this is a kidney, right? This tube is called the ureters. Okay, it's going to be A over here. The functional unit of the kidney is A, B, C, or D. So inside the kidney, okay, there is a unit of kidney that will actually filter the blood. Its unit is called nephron. Nephron. Each kidney usually have about 1 million nephrons. Okay, so totally in two kidney we have 2 million nephron. So the unit is called nephron. A function of the nephron is to A, B, C, or D. Okay, so this is kidney. Then we have nephron over here. And the blood is coming, going to this nephron. Okay, the waste, waste in the blood will be removed by this nephron. So it's going to be remove waste from blood. So it's kind of filter the blood, clean the blood. Urine travel from the ureters to the A, B, C, or D. Yes, we already mentioned this, ureter, and the urine will go to this. It's going to be bladder over here. The tube that connect each kidney to the urinary bladder are known as, we already mentioned that, which is the ureters. Urine travel from the bladder to the, it's again kidney, ureter, bladder, okay, bladder. Okay. There is a small tube, it's called the urethra. So the urethra will take the urine out from our body. This is the urethra. Okay, this is not the answer, so it should be B, okay, urethra. Blood enters the kidney through the A, B, C, or D. This is kidney, this is kidney. We have blood vessel over here, okay? One of them is called artery, and the other one is vein. Okay, so blood from the artery will enter into the kidney. And then from the kidney, it will go back to the vein. Okay, so enter is going to be the artery over here. Okay, the artery that go to the kidney is called the renal artery. The artificial maintenance of kidney function is A, B, C, or D. This is mainly for people that have problem with the kidney. Okay, so they're gonna have the artificial filtration of blood, which is called the dialysis. Dialysis is the artificial maintenance of the kidney. The healthcare provider orders a renogram that is used to study the function of man's main kidney. Okay, so therefore is it. This group of drugs, when given to the patient, increase the secretions of urine. So this is increase. Okay, increase mean diuretics. Okay? Increase. If it is decrease, then it's gonna be anti-diuretics. Okay, so the answer will be this one: increase the urine production. This urea is this urea. Okay, urea, urine. This mean abnormal, or lack, or painfuls of urinations. In urinalysis, bilirubin, okay, so bilirubin in the urine may indicate disease of. Bilirubin is the product of process of blood distractions in the liver. So all blood, the one that's all blood, it has to be removed, it has to be destroyed, and it is destroyed in liver, and it produces the bilirubin. So if you have that bilirubin in the urine, it will tell the condition, problem with the liver. In urinalysis, uremia may indicate disease of the urine. Amia is blood. So this is urine in the blood. It can indicate there is something happening in the kidney. In urinalysis, the presence of acetone, ketone, and glucose. Just look at this one. Okay, this is actually the key. Might indicate of A, B, C, or D. Okay, so people that have a lot of glucose in their blood is called diabetic person. So it might presence in the urine. It indicate diabetes. The normal pH range of urine is, okay, so urine, the normal range is from acid to the alkaline, 5 to 9. So if it is 5 to 9, it's still normal urine, based on what you eat, actually. It can be acidic. So this one is acidic, or go to the alkaline. Cystitis is an inflammation of the cystitis is the bladder. So this is bladder inflammation. Pyelotomy is an incision into the pyelo. Pyelo is related to the pelvis. Remember this kidney, it has pelvis over there. Okay, so pyelotomy is incision into the pelvic. A diuretic can reduce A, B, C, or D. What is diuretic? It is increase urine. Right? When you increase urination, it means that it will remove liquid, okay, or water from part of your body. So this will reduce the edema. The nurse is assessing a patient's urinary output and identify the patient has had no urinary output in 10 hours. The nurse document this condition as no urine. This is no. This is very little. This is so much. So this is not the answer. Maybe between this or this. Oligo mean little. A mean no. So we're gonna choose the no urinations. The nurse is assessing patient urinary output and identify the patient has had scanty. Scanty mean few, little. Little urination. I already mentioned that. Oligo mean few. So few urine. So this should be there. The patient cannot control his urine or feces. The nurse would document this as this is not, this is not, this is not, this is will be the answer. Continence. Atresia can be or can refer to the A, B, C, or D. Okay, of course, this is one is not, and this is not. This is the narrowing of ureters. Hematuria is, okay, hem is blood. Urea is urine. Okay, so it's going to be blood in the urine. The healthcare provider tells the medical assistant to schedule the patient for removal of a kidney. So this is removal of the kidney. The medical assistant notifies surgery that the patient needs a ectomy. Remember, ectomy is removal. Okay. So which one? So this is kidney. Okay. This one is bile. Right? So this is not the answer. Okay. This one also not the answer. The one that closer, okay, because nephron is the functional unit of the kidney. So this should be the answer. The removal of the bladder, usually when cancer is present, is a, okay, remember cystitis. Cystitis, this is related to bladder. Okay. So removal of bladder will be ectomy over here. Cyst. Okay. Cystectomy. Cystectomy. The removal of a diseased ureter is called. So ureter, ectomy, removal. So uterectomy. Respiration is the taking in of air and the expelling of. So the air, this is oxygen. The one is removed will be the carbon dioxide. The left lung is divided into blank lobes, while the right lung is divided into blank lobes. So how many lobes? So let's say this is trachea, bronchus, and then bronchioles, and then lungs over here. Okay. Over here, we have the heart, okay, the heart on the left side. This is okay. So because of this, then the left only have 2 lobes. 1, 2. The right, it has 3 lobes. 1, 2, 3. Okay. So left 2, right 3. So 2 and 3. A test that provides a radiological picture, okay, of the trachea and bronchi is a radiological, it's going to be the graphic, bronchographic. The patient has blood in his sputum. The healthcare provider recognizes this may indicate. So usually people that have TB or tuberculosis, when they're coughing, and then there will be blood on their sputum. So it's going to be indication of TB, which is a bacterial infection, tuberculosis. An organ of the limb system is the A, B, C, or D. Okay, remember, pancreas is for digestive system. Liver is organ for digestive system. Stomach also, this is the one of the alimentary canal of digestive system. So this is the only answer, the only choice, which is the spleen. Limbs contains blank blood vessel. Okay, I mean blood cell. So if it is blood vessel, we have all type of blood cell, red blood cell, white blood cell, platelets. Okay, but it's limb, which is another vessel. It's called the limb vessel. Yeah. Okay, limb vessel. The liquid is called the limb. It's only contain the blood vessel because this is the primary function is to fight infection. Only white blood. Okay. Thymosin distribute A, B, C, E. Okay, so thymosin. So let's say this is our heart. Above our heart, we have a thymus gland. Okay, and the thymus gland produce hormone is called the thymosin. And this hormone function is to stimulate T cell maturations. Okay, so the T cell get mature in the thymus gland by the help of the thymosin. So it's going to be this one, T cell distribution or maturation. The HIV virus is transmitted by A, B, C, or D. HIV, this is the virus that actually attack our one of the T cell, especially the T helper, which is in the blood. So it can be transmitted to the blood transfusion or using the same needles from patient with the HIV and also from another liquid, another liquid of the body. Which of the following is not considered to be an autoimmune disease? What is autoimmune disease? This is the disease that is caused by attack by our antibody. Okay, antibodies, which is IG, attack our own cell or tissue or organ. Okay, so this is autoimmune disease. So this antibody kill our own cell, tissue, or organ. There are many types of autoimmune disease. One of them is called the lupus, rheumatoid arthritis, especially in the joint, between the bone. Osteoarthritis is not autoimmune disease. Multiple sclerosis is also a type of autoimmune disease. So this is not the answer. The question is not. The one that's not autoimmune is osteoarthritis. Osteoarthritis is just problems with the joint where the cartilage of the joints become rigid, become bony, so it's going to be difficult to move. This is usually old people will have this or osteoarthritis. Which of the following is considered to be an autoimmune disease? Okay, so to be an autoimmune disease. Remember, this is not. This is a regular disease. A scoliosis is not. This is a bending of the back. And then, I already mentioned this. This is the one. Gouty is also not autoimmune disease. It is caused by uric acid, not by the antibodies or IG. So this is the one, the RA. RA, rheumatoid arthritis, is one of the autoimmune disease. Which of the following is considered to be an infectious disease? Infectious disease. So infectious disease is caused by organisms, especially microorganisms like bacteria, viruses. Okay, so that's the infectious disease. Which one is caused by this, like bacteria or virus? Of course, AIDS. Okay, AIDS is infectious disease. The rest of it here is not infectious disease. It is caused by part of our body that is not functional properly. But AIDS is caused by virus. It's called the HIV viruses. It's causing the AIDS. I think that's all. Okay, good luck with your exam. Goodbye now.